All right, three, two, one, go, and we are live. Hi everyone, welcome on board. Hope you guys can hear me absolutely fine. Can you guys hear me? Yes, no on the chat button should be helpful. Okay. Or Maitri, if you want to just check the chat as well, you can just go to the channel and you can just see it up yourself as well. Okay,
Okay.
great. All right, hi everyone, welcome on board. Can you guys hear me? Just say yes in the chat buttons. Today we're going to be talking about how to prevent COVID and also how to take care of the COVID when you actually sit back home. This is a series which we're doing for all our students so that by tum bhi awaaz ho bhi desh ki and desh ko bachana hai. And the best thing is we got Maitri with us, and Maitri is a doctor herself, and she's been working with the COVID. Maitri, you worked in a hospital where COVID patients were. Have you helped them like recovering them from the journey as well?
Yeah, we have been to make them feel better by showing them breathing exercises and also showing them what exercises they need to continue after going home.
This is so amazing. And she's also a holistic fitness expert and a physiotherapist, and she's been working in Tumba Hospital. By the way, she's from Bombay. Which area of Bombay? You're from Kandivali Malad, right?
Kandivali West, yeah.
Kandivali West. This is so amazing. It's lovely connecting with somebody from Bombay as well. So, people on the chat, boys and girls, right now, oxygen cylinders ki kami hai. Let's take it a fact. Yes, kami hai. And we can ask these questions on the doctors as well. Now, beds ki bhi kami hai. Let's ask the questions on these doctors. Beds ki bhi kami hai. But once COVID hit you or one of your family members or some people on the chat who have already gone through the same, what are the few things with what we can do as well? But first things first, what they're showing Maitri on the news, is it genuinely true? Sachi mein kami hai ki we're all sorted?
Actually, the second wave has taken a toll on everybody's mindset and also the health. But it's actually true that the cases are increasing because people are not paying attention on the precautions nicely
Mm-hmm.
compared to the first wave of lockdown. So
Okay.
there is a reason of carelessness of the people that the second wave is getting increased.
Okay, that's so true. Maitri, I want your time and energy on prevention as well. But let's first talk about cure. First thing first, COVID has hit us. COVID has hit our parents. What should be doing? What should be the agenda for the sure? First question is: can genuinely breathing exercises can help us a little bit in the whole journey of recovery from COVID?
Yeah, so these breathing exercises help you to get recovery fast. So once you are infected or you're not infected, there are two kinds, the same kind of exercises. Once if you do the exercises which are preventive, and once you have got hit with the COVID, it improves the capacity of your lungs to breathe in and breathe out. That
Mm-hmm.
will reduce the duration of the infection on
Okay.
a run.
Great. What are some basic exercises what do you want to recommend to them कि यार ये basic चीजें हैं, these everybody should do whether you hit COVID or not? What are the first ones which should be done every day?
Okay, so there are three main exercises we teach the patients. So first name is pursed lip breathing. So in this pursed lip breathing, you have to blow out air like you are blowing out a candle. So you hold a paper in front of you and you assume that you have to blow that. So with that intensity, you have to blow like this. So this way you have to do three times. And this is supposed to be done in a day three times and in one set five times. So
Okay.
this is first.
Okay.
Then second one is called diaphragmatic exercise. So in this you have to keep hands on the belly like this, and then you have to inhale through your nose and exhale through your mouth five times each.
Okay. It's like keeping hands on the belly and then doing what?
Then inhaling through the nose and
Mm-hmm.
exhaling through the mouth
Mouth. Okay. Okay. Got it. Got it. So inhaling through the mouth. This has to be done how many times?
five times. All these exercises are supposed to be done five times in one session
Mm-hmm.
and in a day three times.
Okay. What does it help actually? होता क्या है ये करने से? What's going to happen?
Yeah, so in this, all these exercises are basically to improve the capacity of the lung to inhale and exhale the carbon dioxide. So obviously, because the COVID is mainly affecting the lungs, the capacity of the lungs to inhale becomes reduced because it's infected by the COVID virus. So we actually strengthen the muscles of the lungs to push and pull out oxygen efficiently.
Got it, got it. And ये भी बोलते हैं ना कि you should be actually. I was just talking to a doctor yesterday, and he was recommending it that we should be always we can मतलब उल्टा सोना
Lie down.
चाहिए rather than lying down. So does it help? I was thinking it last night when I was trying to sleep. I was imagining कि जब मैं उल्टा सो रहा हूँ मेरे lungs ज़्यादा contract हो रहे हैं. But is it the other way around?
Yeah, so basically the science behind it is when you sleep on your belly, the more amount of oxygen goes because there is a more capacity for the lung to expand. So more the lung expands, the more oxygen goes and the more blood is pumped by the heart.
Great, great. This is so amazing. This is so amazing. So moving forward, that's exercise number one. Boys and girls, keep a note on the same. Keep a note on the same as well, and check it up in your head. Fix it up. That's the number one exercise. What a patient, what a doctor who has been dealing with the patient so far is recommending you. You spoke about three exercises. What's number two and number three?
So second one was this called diaphragmatic, which was keeping the belly, hand on the belly. The third one is thoracic expansion. So thorax meaning the chest wall, and expansion meaning increasing the capacity of the thorax to inhale and exhale. That is the capacity of the oxygen to go in and out. So you have to take your hands up and inhale, and while taking the hands down, you have to exhale.
Oh, great.
So you have to continue this for 5 times, and in one set you have to do 5 times, in a day 3 times.
Okay, lovely. So by phone thoda dur pe rakho. I'll also try along with Maitri. So it's like this, and then
Inhale,
inhale
exhale.
and then exhale. Okay,
Yeah,
okay. I used to do it when I used to practice yoga. Yeah. So when you need
yeah.
when you expand, then you expand your body, then you actually breathe in. Then it's like breathing out and taking your air out. What happens with this exactly?
It's all these three exercises are mainly to improve the lung capacity, but in this specifically, the thorax gets expanded. So the more it gets expanded, the more it allows the oxygen to go inside. And
Mhm.
once we come down, we exhale. So whenever we exhale, there is carbon dioxide going out of your body, which
Mhm.
carries the toxins. So which
Mhm.
gives you a calming and soothing effect after doing this exercise.
This is so lovely. This is so lovely. So number two, number three, boys and girls, people who are listening to this, एक छोटा सा काम कर दीजिए, hit a like button on the chat so that this video you should reach out to more people and अपने parents को भी करवाइए. I swear to God, I'm going to make my dad, mom sit and put this video on a big TV, and I'm going to make sure that they do the exercises from today only. What's going to be number three? My three.
So the first one was pursed lip breathing, which was blowing out like the candle. The second one was belly breathing, and the third is thoracic expansion exercises. The fourth one is including limb exercises. So limb meaning your lower legs. So the lower legs needs to be mobilized after 5 to 6 days, because already the patient will be weak, lying down on the bed. So there is no mobility of the legs or the entire body happening.
Mhm.
So we asked them to do exercises like moving the leg out and in of the bed, or if suppose we consider this as an ankle, so the ankle has to be moved up and down this way, and then rotate right and left, and then in circular motions, clockwise and anti-clockwise.
Mm-hmm. Okay, this is the warm up yoga exercise as well. So keep your feet like this and rotate your feet like this, right? And then aage
Yeah,
piche. Can
yeah,
you do
because
that
there
again?
is no,
Can
yeah.
you do that
So
again?
these are the ankles. This is forward movement. This is
Mm-hmm.
backward movement.
Okay.
Then right, then left,
Okay.
and then rotate clockwise and then anti-clockwise.
This is to increase the mobility of the patient, because once you got COVID, you are on the bed for about 10 days or 14 days or maybe 7 days or 8 days, depending on how early you can actually recover. So you should be improving your mobility as well. Why mobility want to be increased? I mean, I know it's a basic common sense question, but is it linked with COVID as well?
It is linked with COVID because overall the capacity of the entire body is weak. Now
Mhm.
the patient is bedridden for more than 10 to 14 days. We want to give them discharge, but the muscles have already become weak. So we
Mhm.
have to start the training from the sixth day. So by the end of the discharge, the patient is full-fledgedly able to stand on the legs without any weakness. So this
Mhm.
basically pumps fresh blood through the legs and into the entire body, and helps improve the mobility. So when the patient is discharged, at that point of time, the patient is muscles are strengthened to go.
Got it. Got it. Got it. I want to ask you one question, which is the most important question, which a lot of Indians need it right now, and we are going through the same. One of my cousins, in fact, 1 week back, he was not getting an oxygen cylinder. He was getting it from his brother, and he was COVID himself, and he was trying to get oxygen in the entire market of Delhi to Rajasthan, and he moved out to some parts of UP as well to find oxygen, and he couldn't find it, though later on after 2 3 days somehow things fell in place and now he's all recovered and everything is good. But can yoga or breathing exercise help a COVID patient if it has hit us, and we are trying to rush our loved one or ourselves to an hospital and there is no oxygen available? What are the few first aid breathing techniques we should be talking about when we talk about helping those patients?
Okay, so there's a term in medicine that is called dyspnea, which relates to breathlessness. So these positions are called dyspnea relieving position, that is breathlessness relieving position. So few of them I will tell you, like whenever you're standing, you can lean on a chair. Like if suppose there's a chair in front of you, you hold the chair, lean forward and exhale 2 to 3 times and then again come back. So you repeat this method 2 to 3 times and your breathlessness comes down.
Can you
So
do that
this is
again if
one.
you don't mind? One more time, please.
Yeah. So if suppose there is a chair in front of me, I'm holding the chair. Then I'm coming leaning forward. And then I'm exhaling 2 to 3 times and then again coming back. Then I'm repeating the same thing once, twice. So what will it do? It will reduce the breathlessness after a few times of doing the exercise. This
Okay.
position is one of it.
All right. There's already comment in the chat as well. I've got cough at night, some shortness in breathing. This is a quick tip, guys. You guys can take it from the doctor herself who have been treating COVID patient. It helps you to reduce breathlessness. That's number one. What exactly happens when you're doing this?
Okay, so when we are coming forward, there is increase in the diaphragmatic expansion, and when we exhale, we are exhaling out carbon dioxide. So it allows more oxygen to go into the lungs by
Mhm.
exhaling more of the CO2. So the trapped CO2 gets exhaled. There's
Okay.
more room for the oxygen to come inside.
Okay.
That in that way, the oxygen levels come back to normal. So this
Okay.
is also one method for improving the saturation levels.
Okay, great. So, and what are the other things we need to keep into mind? We are trying to reach the hospital. There is no oxygen available, no beds available, no doctors available. That's the real situation of country right now. Anything what patients can do on their own?
Yeah, so this was one. The second method is if the patient is sitting down, the patient can put a pillow in front of the table and then fold his hands like this and put his hand like this. So while resting in this position, the patient feels less breathless than before.
Okay. Okay.
So
So you keep the pillow
keeping
like
in
this,
yeah,
and then you keep it like this,
like this, and then just rest your head on it like
and
this.
you do this. Okay. Okay. What
Yeah.
happens with
So
this? Your lungs expand.
yeah, so in this position there is less activity of the gravity on the diaphragm, so it allows the lungs to expand more. The same mechanism. Don't want the gravity to actually restrict the breathing. So this is an anti-gravity position or a semi-eliminating position where actually the gravity does not work and it allows the lungs to expand. So all the mechanism behind this is expansion of the lungs and exhaling out more CO2.
So even if you're taking our patient to a hospital, we can always tell them to keep a pillow. Yaar. Even ambulance mein bhi baithe hue, hain, we can always tell them to do that. It's going to be much more beneficial. That's great. Number two, any other exercise? What do you recommend when there is lack of oxygen or we're not able to reach the doctor on time?
Yeah, and also there is something called a SCARP protocol, when which we teach the patients that whenever the patient is lying down, we ask them to change their position of lying every 30 minutes. So, like if the patient is lying on right side, then you turn after 30 minutes on the left side. After the left side, you sleep on the belly and then come to straight. So every 30 minutes, it is important for the position to be changed because majority of people have secretions in the lungs. We want the secretions to be mobilized to the upper respiratory tract, and we want them to expel the sputum or expel the secretions. Because if they get contained in the lungs, it will expand and it will infect other areas. We don't want that. We want the cough to come out.
Oh, got it. So you're when you're sleeping like this on your facing the wall, say for example, and then you go and change in the direction when you're facing down or in the direction you're facing up.
So it is like alternate position. It is like you're
Oh,
rotating the secretions in all the foot positions.
oh, lovely,
Yeah.
lovely, lovely. So you actually do a 360 degree. You sleep like this, then you sleep like this, then you sleep down, and then you sleep down for 30 minutes each. In short, you don't
Yeah.
sleep only, but you rotate the entire what do you call it? The
So
secretions in your
carb
lungs.
carb protocol. Yeah.
CAR protocol. Okay, and you take the secretions out so that secretions don't affect to the other part of the body and rotates, and it actually come out from the top. This is so amazing. This is so amazing. Maitri, one last thing. Today we have spoken about the entire COVID thing. Once it has hit us, how we should be dealing with the same. There are a lot of users who are listening to the same as well. Boys and girls, just do a quick hit a like button for Maitri and say thank you to Maitri. And I'm also going to ask her a very difficult question, which is going to be really helpful. And thank you, Shaurya, for your kind. The people who are donating funds as well. So we are trying to donate 5 lakh rupees in the coming 10 days, and we're going to be helping a lot of patients in Delhi, Bombay through our small initiative. So we're getting Shaurya has given us ₹100. Thanks, Shaurya. I appreciate your kindness, man. Thanks. So, Maitri, first things first, what are some preventive yoga techniques? You've spoken about the COVID. Let's talk about some preventive measure techniques. कि यार ये सब चीजें करो and COVID cannot hit you, or it'll hit you in, even if it's hit you, it's going to hit you in a slightest of the possible areas, and the damage will be less. What are the few things?
So steam inhalation. Steam inhalation is one of the very important preventive measures. So it is very important to understand why there is so much of a thing called about steam. So what happens is there are different temperatures of the steam. So at 70 degree, like according to the latest research, because the research is still ongoing, but according to the latest research article, at 70 degree of Celsius, the virus becomes disabled or it becomes paralyzed. So whenever we are taking steam for say about 5 to 10 minutes, we should make sure that we are inhaling it through our nose and through our mouth. So when that heated amount of temperature hits, even if it is there in the paranasal sinus, which is situated here, it does not allow the virus to go inside the bronchi and then infect the lungs. So the progression of the disease gets cut down at the initial level when it is in the nose.
Mm-hmm.
So even if you have gone out or you have been recently infected and you don't know, because sometimes there are asymptomatic cases as well.
Mm-hmm.
Even in that asymptomatic era, you have taken the steam twice or thrice. It eliminates the virus at the nasal level and does not allow it to progress down to the respiratory tract and then infect the lungs.
लवली. तो भाई जो स्टीम तुम्हारी मम्मी बोलती है स्टीम ले लिया करो फॉर श्योर. सो उसको नीचे जाने का ही नहीं अपने को, उसको यहीं पे रोक दो.
Yeah.
तो हेल्प टू डू दैट. सो ट्वाइस अ डे इज इनफ, Maitri?
So for the people who are in the house and not going anywhere should take once. Those who people are going out and coming should take twice. And those who are actually working with COVID patients and are healthcare professionals and too much of long exposure outside, they should take at least 3 times a day.
At least 3 times a day. Wow, that's
Yeah.
that's so amazing. So boys and girls, at least once. What's your preferred time, morning or evening? I normally do it in the night before I sleep. What's the
The
best?
time is actually any time according to you convenient, because we just have to take steam. So depending on your work schedule, your everything, you can manage it. So there's not an ideal time to take steam.
Great.
Just the duration is important.
Lovely. So through our channel, boys and girls, hit on the like on the stream so that this should go to as many number of people. That's the objective of doing it. So Maitri is giving us tips, and people don't know Maitri. Maitri is a holistic expert. She's a fitness expert, and also with she's done her masters in physiotherapy as well and sports as well. And the best thing is she's serving the COVID patients. So life is too short to do your own mistakes. Learn from other people's mistakes, yeah, or learn from other people's expertise as well. Maitri, what would be your tip number 2 for all these people to prevent COVID? Because ye aur nahi phailna chahiye, that's the objective.
Yeah. So all the breathing exercises which are shown, like pursed breathing, the diaphragmatic breathing, which is also called belly breathing, and thoracic expansion, they can to be done on the preventive aspect as well.
Okay, so breathing जो हमने 3 exercise ही करी, तो breathing वाली exercise भी, one is like candle blowing as well, that's number 2.
Yeah.
Candle रखो और उसको सामने रह के blow करो, that's number 1. Secondly, you keep your hands on the chair and you just move down a little bit and just do the normal breathing there, right? Because you're working against the gravity. So keep your hands on the chair and then do normal breathing for about 5 times. So candlestick is also like when you, it was again
yeah.
breathing.
The first one was breathing from the nose, and you have to exhale like in a such a way that the candle flame is getting off, like like फूक मारते type.
Like फूक मारते जोर से. That's number 1. Number 2. Number 3 is what?
Number 2 is this one, belly breathing.
Belly breathing, right?
Yeah, and the third one is this.
Keep
up and down, and then down.
Great. These are basic lung exercise to keep your lungs stronger. It's going to be really helpful. So number 1 is steam. Number 2 is this. Number 2 is exercise. What's number 3, Maitri?
Okay, so for most of the patients we give is preventive as well as post-recovery period. We advise them to buy incentive spirometry, which will be available on Amazon very easily. So there are 3 types of balls in it, which you have to blow. Like you have to inhale like this, like you're sucking up a popsicle, और जो गोला बोलते हैं, तो उसको कैसे चुस्की लेते हैं, वैसे चुस्की लेना है. So the ball goes up. So each and every ball has a capacity of lung volume which it indicates. For example, there is green, red, and blue. So each of the ball has a specific lung capacity. So it indicates how much capacity you have right now and how much you have to increase it. So that is basically to improve the strength of the lung musculature.
Oh, great.
even in the preventive as well as post COVID recovery.
Right, right, right. तो भाई इतना बुरा हाल हो जाने वाला है कि you'll not be able to take the air out of that ball as well. You can imagine that people are feeling fit right now when COVID hits. Breathlessness मतलब oxygen चाहिए होती है. When people say oxygen चाहिए होती है, oxygen actually when they're on a ventilator, oxygen is forced into you, right? It's
Yeah,
forced into
yeah.
you. Right?
Because the lungs are not actively trying to do the blood circulation, actively trying to get the oxygen. So that work is done by the machine, but that is called artificial ventilation. Artificial, the oxygen is going into the body.
Okay, this is so amazing. So, Maitri, I'm sure you must have seen so many deaths in the past day. Was it like one or two people dying every day, or how was it when you were in the hospital working with the COVID team?
It was like a very sudden because of the new variant, which is supposed to be reducing the saturation level at a very faster level. So if one patient I'm seeing that it is 97, even in the ICU, the second day, I see that the patient is no more. So it is like very unpredictable situation. So looking at this scenario, I would like to suggest that more the precautions that people take, the less they have to suffer in hospital.
Great. By more the precautions you take, lesser you're going to be suffering in the hospital. These are the parting words what Maitri has to say. Maitri, thank you so much for your time. It was lovely having you on board. Boys and girls, say a quick thank you to Maitri, and it's really, really amazing. And people are working really hard with us, and they're spreading the message. And also, we're trying to raise some funds for 5 lakh rupees for all these patients. So, Maitri, I deep heartedly say thank you to you. Boys and girls, say a quick thank you. They're all saying thank you to you on the chat as well. That's lovely. All right, Maitri, thank you so much and have a good day ahead. Bye bye.
Thank you. Thank you so much.
It was lovely having you on board. Boys and girls, to listen to all these advice given to you, बस ये ले लो और चलते जाओ and just be safe wherever you are, यार. Wherever you are, be safe. It's going to be really helpful. ठीक है? Bye bye, guys. Take care. रुको Maitri.
Yeah.